Okay.
Chapter 14.
Care of the patient with a neurologic disorders, chapter 14 of adult health nursing, the yellow book.
Yellow tea.
And starts with anatomy and physiology, structural divisions. You notice central nervous system, only the brain and spinal cord, peripheral nervous system, and then the autonomic nervous system. And this is again the neuron, this is the cell body, the axon, and the myelin sheath. Okay, let me just point out here, we didn't discuss it, we discussed the synapse, right? So this is the, can you see this is the myelin sheath, and there's this space here, right? That's the node of Ranvier. Node of Ranvier. So instead of the impulse having to go from here and going here, here,
She's
here,
studying.
before it reaches here, it will just jump from one node. It will jump quickly and jump and jump. So make saltatory conduction. It's a faster conduction. So if there's no myelin sheath, for example,
Can't jump.
in a condition known as multiple sclerosis, have you heard of this disease? MS.
Wisconsin.
Okay.
It doesn't jump.
The axon is demyelinated. Okay, we're going to do why after, but later. But in that condition, in that disease, the problem is there's demyelination of the axons. So saltatory conduction cannot happen. So there's a problem with the transmission of the impulses. So there could be a lot of problems in the movement. Sometimes it could even lead to paralysis. Okay, that's multiple sclerosis. This is just the synapse again, and here these are the vesicles that contain the neurotransmitters. So it could be acetylcholine, adrenergic, it could be dopamine. Okay.
That's not our book.
No. Okay,
See?
so this is the synapse. No, actually, it's the neuromuscular junction, not the synapse. Synapse is between neuron to neuron. This one is the neuron to the muscle. So the nerve that innervates the muscle has to stimulate the muscle too. So for the muscle to move, just like the reflex that we're talking about. So it's the NM junction, neuromuscular junction. So if this is what I said is the sole foot. Remember I told you the sole foot.
It's the yellow part.
Okay, and it will also have a synaptic cleft, just like the synapse. Okay. Then the neurotransmitters could be acetylcholine, norepinephrine, dopamine. So dopamine is, what do you know?
It makes you feel
Dopamine
good.
is deficient in what condition? Dopamine? Parkinson's disease is exactly right. Dopamine. And serotonin, sometimes something to do with sleep and has a role in control of mood. So a lot of those antidepressant or mood changing drugs will have some action on the serotonin. Okay. Then you've seen these diagrams before. The neurolema and the myelin sheath is the fatty layer over the nerve fiber, a nerve tract. Okay. And the brain is, this is the cerebrum. This is, what is this?
Cerebellum.
Cerebellum with the arbor vitae. And the cerebellum, second largest. Hypothalamus controls, controls the hormone production of pituitary and also water balance and also temperature. Brainstem, 3 parts: midbrain, pons, and medulla oblongata. See, medulla oblongata controls heartbeat and breathing. Heartbeat, breathing. That's why when they hit the carabao, the medulla, the heart stops, breathing stops, the carabao dies. Okay, remember that story I told you?
How do they get it?
Huh?
That part right
Yeah, at the neck part. So sometimes when you get hit by a karate chop, right here, remember, karate is Japanese, right?
here?
Chinese is kung fu. Okay.
The way of the intercepting fist.
Open fist. When you get hit here, sometimes it will affect your medulla. Okay, so this is the medulla just above the spinal cord. and this is the pons. You've been through this before. Then the membranes, dura, arachnoid, and pia mater. Here, this is a better drawing. So this is scalp, the skin, and then the cranium is the bone, and then the outermost layer is the dura mater. Above it is the epidural space. Underneath it is the subdural space, and then the arachnoid is the violet one. Okay, the next one, and underneath the arachnoid is subarachnoid space. That's where the CSF is found, and then closely attached, practically attached to the brain tissue, is the pia mater. Okay. Then spinal cord, the second part of the central nervous system, two functions. These are the two functions, basically center for reflex actions. And this is the spinal cord, as you know. This drawing is a little off because it should stop at about the level of L1, right? This one it continues down to the sacral and even to the coccygeal aspect. And this is just a specimen that was taken from the spinal cord. So CSF is a clear fluid, flows into the subarachnoid spaces and around the brain, the ventricles, right, and the spinal canal, right. It also acts as a cushion. So just imagine the brain, a very delicate tissue, inside a hard skull, hard bone, right? And it's suspended by CSF. So it's like floating in there. So it acts as the fluid in there acts as a cushion to cushion the brain, so that the brain will not be hitting cannot hit because there's fluid in between, right? So that's one of the functions of the CSF. However, if the trauma is so violent, like in a concussion, there could be an injury to the brain itself. Remember, there was a movie in 2014, I think, Concussion.
The doctor?
Will Smith?
No,
Will
with
Smith.
Will Smith.
Yes.
Yeah, and the NFL
Concussion.
didn't like it.
They shut it
Because-
down? We haven't heard of it since?
Huh? It was not very successful, I think, but that was the topic of it. The concussion among football players.
This is the African doctor.
Yeah. So it contains protein, glucose, and salts. That's why when you have head injury and there's fluid leaking into the nose
Mm-hmm.
or the nostril, there's fluid. You don't know whether that's just water or that's just from the nasal mucosa, the mucus, or whether it's CSF. How do you test?
Sugar.
You test for sugar, the glucose. And if it's positive, then it's most likely CSF that's leaking. Okay, you still remember that. Now, it can also be part of the blood-brain barrier. It will protect the brain from any, it's like border police, right? It will prevent the terrorists or other undesired aliens from entering the country. So it's the blood-brain barrier. Okay, it's a natural barrier so that infection from other organs cannot easily spread to the brain. However, the blood-brain barrier will also prevent easy access to the brain by the drugs. So if the patient has an infection like meningitis, sometimes it's more difficult to treat with the drugs because of the blood-brain barrier. So you have to choose a drug that's able to cross the blood-brain barrier. You understand? So that is the application of this knowledge in pharmacology. So here we've seen similar drawings here. So these are the different lobes. Each lobe will have different functions. Like, for example, the occipital. Does it show? The occipital lobe is somewhere here at the back of the head. Occiput is somewhere just the front. Here, somewhere here. Okay. The occipital lobe usually is responsible for vision. Okay. So if there's a problem, a stroke in that area, so the main problem would be visual symptoms. So you don't want to be a neurologist, right? So we'll just keep to the nursing, what's important to nursing. So here, this is the picture that I wanted you to memorize, the names, and whether they are, so the difference here, the cervical portion has 8 segments has 8 nerves, rather than just 7 segments. That's why the total is 31. Alright, the coccyx even has 1. Even the coccyx is represented. So we've been through this, functions of the autonomic nervous system, sympathetic is fight or flight. And there's another term for I don't remember anymore. It restores the energy. Rest and what?
Digest.
Yes, rest and digest. Rest and digest. Instead of fight or flight, parasympathetic is rest and digest. That's one of the mnemonics, right?
Uh-huh.
Did I give you the mnemonics, the 98 mnemonics? Did you study it? I don't think so. No? Okay, for the HESI exit, you need to study that. I'll give you if you have 1 month to study, I'll give you a 1 month calendar. A study calendar 1 month before your HESI exit. And it's proven to be effective, so you just have to stay with that calendar. And the time comes, okay? So these are the sympathetic and parasympathetic responses, different body organs on that side. So I told you to just remember the sympathetic and just, if it's the opposite of what you remember, then it must be parasympathetic. Okay, I've given you examples earlier. Same thing here, same slide. There's also a beautiful table on that in your book.
No. It's not in there.
No, in the structure and function
Oh.
book. Oh, it was in there. About sympathetic and parasympathetic. This one. The one,
With the green and red.
yeah, the green
whatever.
and orange. It's the same thing.
Okay.
Yeah, that's what I meant. What page is that, Kaden?
191.
191 on the structure and function. Not this one. But it's basically the same thing.
That's the previous videos.
Okay, so this is a cut of the, I think that's the spinal cord. This is just to show the same thing, the Vannery reflex, okay?
Yeah.
The knee-jerk
Nice.
reflex, the patellar reflex, okay, the spinal cord. So this one is the sensory, this one is the motor. Sensory is also known as the afferent, and the motor is also known as the efferent. Effects of normal aging on the nervous system, loss of the brain weight, loss of neurons, even loss of memory. Does it say here? No, maybe in another slide. So another evidence that as you get older, you lose a lot of your functions, or a lot. So nobody wants to get old, but it's inevitable.
Except for kids.
So prevention of neurological problems, when you're young, you like to party, get into recreational drugs, get to alcohol. Eventually, these are not good for your brain. Remember, alcohol, I told you this over and over again, is a direct poison, direct toxin to the liver and the brain cells. Okay? And safe use of motor vehicles, do you know the correlation? And safe swimming practices. Because if you drown, you cut off oxygen to the brain gets damaged. You get into a motor vehicular accident, you could suffer a severe concussion, damage to the brain. Also, safe handling and storage of firearms, you could blow your brains out. Hopefully not. And then in a construction area, use of hard hats and use of protective padding as needed for sports. Football. Okay. But there have been basketball players who had concussions too, right?
Yeah, we throw elbows.
So assessment. So with that, with structure and function, we've been able to breeze through the first 19 slides. So let's take the break here, and then we'll continue with assessment. And I'll try to finish as much as we can, and that will be part of the quiz next week.